Welcome to episode 151, When We Are Not Okay, Understanding and Managing Compassion Fatigue, featuring Dr. Dain Kloner, licensed marriage and family therapist. Make sure to subscribe to be alerted about future episodes. By Clearly Clinical, learn, grow, shine. Hello to our listeners. My name is Beth Irias, and I am delighted to be joined by my colleague, Dr. Dain Kloner. His jam, oddly enough, is burnout and compassion fatigue and understanding how self as therapist affects the therapeutic relationship and therapeutic outcomes and what we do to deal, because we're human beings too. So thank you so much for joining us, Dr. Kloner. Why don't you take a moment to tell our listeners about yourself and how you came to do this particular work?
Okay, great. Thanks for having me. I was working with the indigent population out of school. I was an intern and with the adult homeless population, and I was working there in the clinic for over 6 years. And I started getting, I started feeling compassion fatigue and burnout. And as most anybody would with a clinic. And then I thought to myself, well, I've been doing this a long time, so let's delve in deeper and get a doctorate. So I went and got a doctorate. And when I was doing research, I really fell in love with the idea of what it means to have compassion fatigue, because I'm the worst kind of patient myself, and realized that I was falling into the same traps as everybody else, where I was taking care of others and not necessarily myself. And then when I was actually doing the doctoral research, I found out that I had about 80% of the symptoms that I was researching, and shortly thereafter decided to leave because I needed to. Finished up my dissertation and then started doing my own private practice so that I could, I think the idea was to take better control of my needs and be in more control. So so that's what I did. It's been a long journey, and I realize that I still have a lot to learn.
Well, thank you for joining us to discuss a topic that I think is very sensitive for most, if not all of us. As we record this, we're in April of 2022. We've all been through now over 2 years of pandemic. We're in the midst of the Russian and Ukraine war, unbelievable mass shootings, racial unrest. It's a lot right now.
It's a lot.
And so we're feeling it as human beings, not to mention whatever is going on in our little lives, not just in the news. So thank you for joining us for a topic that is so heavy and important. So burnout is, I think, a really complex thing in therapy land, if you will, like for therapists, because I think we're probably not very good at assessing what that is. And we're also maybe not even familiar with, as you said, compassion fatigue. Can you start, Dain, by explaining the difference between burnout and compassion fatigue, and then kind of breaking down what those concepts are, just as a foundation for this conversation today?
Yeah, of course. Compassion fatigue itself, it's differentiated from burnout, where compassion fatigue really is a response to the people who suffer from trauma, and burnout is a response to work situations. So a lot of times you're going to hear words like secondary traumatic stress, vicarious trauma or vicarious traumatization, and you'll hear compassion fatigue and burnout, and you'll hear them all rolled into one. They're subtly different. Mm-hmm. One leads us to depressive symptoms. The other one leads us to feelings of hopelessness. Burnout itself really is related to the workplace, where it's a lack of resources, where the work is unsustainable, where there's competition, and maybe not enough of us to go around for the work that's offered. And you'll find this a lot in clinics, which unfortunately is the case. I mean, it's the nature of the beast, really. We always say, something's got to change, but it's a difficult thing to implement and change, because the marriage between getting funding and justifying the funding versus caring for the people that actually need the care don't always gel well together. But as far as compassion fatigue is concerned, there's not a lot of, at least 10 years, up to 10 years ago, there wasn't a whole lot of research on it. Charles Figley did seminal research on it in the late 80s. and he really coined the term compassion fatigue in 95 to identify, to define it as a reduced capacity or interest in being empathic, or as he says, bearing the suffering of clients, and it's the natural consequence of behaviors and emotions resulting from knowing a traumatizing event experienced by another person. And so the best way I can explain that is that as we sit in the room with somebody who's smoking a cigarette, they may be getting all of the carcinogens, but it was found later on that even secondhand smoke can impact somebody the very same way. So we take on those carcinogens, and when we take on the pain of other people, whether you're a therapist, a priest, or anybody in the helping profession, you're taking on that pain to a relative degree. Your body absorbs it, your mind absorbs it, your emotions absorb it, your spirituality absorbs all of that pain. And we have to know how to better accommodate and even compartmentalize that pain to a degree so that we're not as affected by it and we can be more effective in our work.
So you're saying compassion fatigue is directly related to the hearing of trauma, the hearing of traumatic stories versus burnout, as you said, being from the workplace.
Correct.
But as you pointed out, we so often see those as happening together. But I want to point out that distinction because if you're viewing those as separate entities, you could have compassion fatigue while having no burnout.
You can. And you can, relatively speaking, you could have burnout without compassion fatigue, but because they're so closely related, they're paralleled so closely, that you can, it's not a wonder to me, and I don't even get upset knowing that I know the research. I don't even, get upset with people who are frustrated by the idea that they intermix, those two terms.
Yeah.
Compassion fatigue is our fatigue, our emotional distress, our apathy, and it results from the constant demands of caring for others. A lot of times there's a state of tension or preoccupation with the individual, or it's based in cumulative trauma. So sometimes we get triggered in session unknowingly. So we experience, or we re-experience traumatic events. Sometimes there's a persistent arousal within us in our bodies that we are not aware of. And because we're always so used to pushing it down for other people that it becomes second nature to us. And at least we think we're doing the right thing by pushing it down rather than expressing it, maybe even in that moment by saying, I'm feeling what you're feeling. Sometimes bringing that awareness can reduce some of the effects of compassion fatigue. Having educational forums like this or workshops or things like that can really help people be more aware. So, sometimes when we experience compassion fatigue, there is a detachment, and that leads to a lack of empathy. Whereas if you have secondary traumatic stress, you feel the emotions of things, but it leads to an increased vulnerability in self if we're not caring for ourselves more often or with more consistency. And then with vicarious trauma, the difference is that we share one's intrusive imagery, and that leads to a loss of hope. And burnout itself is dealing with a sense of depleted resources, which can lead to frustration, depression, increased anxiety. And of course, it's difficult to manage those things when you feel like the answer is managing other people's worry or concern or problems instead of your own.
This is such an important conversation, and I'm even realizing how hard it is for me to have this conversation. And I can only imagine how it is for our listeners. Having been through the storm of the pandemic, like everybody, we're all in different boats. So what anybody's experience has been of struggling with isolation, if you're without much family or friend support, or if you're not partnered off or struggling with being a single parent with multiple children, like the idea for so many people has the idea of caring and compassion fatigue. Even for me, it's felt like this empty bucket just within my family, let alone with anything going on with clients. And I think that we therapists probably have a lot of defensiveness around this idea because it's like, well, that's that thing that happens to that person. That's not something that happens to me.
Yeah.
because I get mani-pedis, and because I go on 45-minute walks twice a week. I can see how any of us, myself included, come up with these ideas of like, that's anybody but me, because we in our culture really love to reinforce the concept of strength.
Yes.
And if
Yeah.
we take time off, it's because we're being weak, or we're self-centered. And so we have so much messaging. Like I'm sure you've seen it. We both worked in the kind of
Yeah.
therapy mill environments of public mental health treatment. And I swear you practically get a gold star if you say, I worked all weekend, I'm not sleeping well, I didn't have time for lunch today.
Yes.
Then it's like, then you're doing it right. Welcome to America.
Right. Right. I think I like to believe that is slowly eroding. I want to believe that. The truth is it's not. You're right. You get a gold star because if you're working overtime and work yourself raw to the bone, and then sometimes for some reason you get a trophy,
Yeah,
or a medal. And I think those days, at least my hope is that, and with some companies, some cultures of different companies, is the idea that they're really embracing self-care. They're embracing the idea that a healthy person is more beneficial to them, and that taking one day off is better than for them to have to take 3 days off because they literally cannot work. It's a concept that health insurance companies have known for a long time. It's a concept where having a healthier patient, even if it means more money for them up front, or that they take more of a loss because there's less productivity to a degree, means that they're saving on the back end, because a person who takes 3 days off of work because they want to don't have to take off a week and a half because they got sick or were physically unable to.
The ever important PEI, prevention and early intervention
Yes.
world. So why don't we talk about what compassion fatigue does to therapy? How does it affect clients? And then I want to talk about kind of the different stages of compassion fatigue and what we do when we're just feeling it versus like deeply mired in it. So I'm sitting here, like I joked with Dain before, I need to get my bowl of popcorn and just sit here and eat while he's talking and just pay attention and listen up, because it has been so much for the last few years. And I hope for the folks listening to this, that you see you're not alone in burnout and or compassion fatigue.
Absolutely.
It's been a heavy time.
Yeah. It's interesting because I was just reading an article last week talking about the difference between a quarantine and isolation, and how a quarantine, isolation is the physical isolation, right? Quarantine is just it's considered an unpleasant experience for those who undergo it. And it's separation from loved ones, the loss of freedom or the idea of freedom, uncertainty over disease status, uncertainty over a lot of things, sometimes boredom. And on occasion, this can create traumatic effects. So whether that's part of our own anxiety or our perception of what's going to happen, we all know that with anxiety, we can build it up pretty well in our minds, the awfulness. And so we get into our minds that something's not going to end. And if we don't see a light at the end of the tunnel, it becomes a scary place. That fear becomes an underlying platform from which we make decisions, from which we utilize our executive functioning. So when you ask me something like, how does it affect therapy? One of the first things that I think about is that because compassion fatigue is related to our own unresolved personal trauma and loss, it can affect how I take in information, how I extrapolate it, how I put it back onto the client, how I respond to it, whether it's, up to 90% of our communication is nonverbal. So how am I really responding? Am I responding unconsciously in a way that's unhealthy or not responsive to the client in a more positive or effective way? Thinking about how a lack of empathy can be something so subtle, but not catching what a client is saying because I'm in my own world thinking about my own issues. That's not an uncommon thing. High frequency of exposure to traumatic material is it's exhausting in and of itself. And if we're not caring for ourselves, then we're pouring from an empty cup, which we can't do. And we're caring for arguably the most vulnerable in society. And so sometimes what happens with compassion fatigue is that we may not be connecting on the same level. We may not be understanding some of the social cues or references or social references, even some of the nuances like using humor, or utilizing the ideas of gratitude and forgiveness. The thing about compassion fatigue is that just like any trauma, it's the things that help contribute to our own lack of security or safety. And if we're not feeling safe and secure within ourselves, how can we expect to model that or help others gain perspective on that if we're not doing so, if we're not caring for ourselves?
As you talk about this, you talk about the gravity and the weight of hearing these stories, being sometimes part of these stories with our clients, and just the nature of our work. You can't be a therapist without discussing trauma. It just doesn't exist.
Yeah.
Why do we do it? What's the benefit when
Why
we're
do we
thinking,
do what?
why do
Therapy?
we,
I don't know.
why do we, what is the, I guess, I don't know if it's an altruistic or selfish offset.
I mean, an argument can be made for both, right?
Yeah.
I mean, I think it's interesting because, and what I'm finding, and we find this, again, the parallel to business too. Back in the day, right? It was always, the CEO was on the 50th floor, or the highest floor. They were untouchable to a degree. Whereas now, and I'm relating it to business because I'm seeing some of that change even as I talk to clients, that the idea now about being more comfortable is accessibility and vulnerability. I'm finding that, it's no longer this, I've known this for a long time, but this is how I operate, but it's no longer the days of psychoanalysis to a degree where and I mean that in a stereotypical sense, where a person's laying on a couch and you're sitting behind them and then drawing notes and making analysis. It's about engaging. It's about the connection. And Anna Freud and Melanie Klein, I mean, back in the 20s and 30s, were saying people are yearning for a belonging, and it's about the connection. And if I can connect with my client, and sometimes that doesn't mean that we share the same love of, rom-coms. It means that we share a connection where we can both be human and acknowledge the difficulty in what it just means to exist, let alone live. So for me, and Charles Figley said this as well. He said, compassion fatigue is a state experienced by those helping people or animals in distress. It's an extreme state of tension and preoccupation with the suffering of those being helped, to the degree that it can create a secondary traumatic stress for the helper. Again, when you're taking on the pain of other people, you have to filter it through your own experience to a large degree, because that's really, in making a connection, that's what helps somebody move through it, knowing that part of their community has been through something before. A lot of times when I'm teaching classes, I just did this class on Tuesday. I had them answer questions about themselves and then get into groups and share their experience of the questions, like what they learned about themselves or what was something they overcame. Part of what offered many of them relief or reduced anxiety is the idea that they knew that they weren't alone. We often forget that we are not alone as caregivers. And so we want to take on the pain almost, I don't want to say it like this, but for lack of a better word, there's a martyrdom that kind of goes with that. Again, kind of like the overtime. I'm working a ton, with nothing to really show for it. Is my taking that client on at 8 p.m. because that's the only time they can meet, is that healthy for me? Is that effective for our relationship? One of the greatest things about moving on from compassion fatigue is setting boundaries. It's something that took me a long time to learn. But I've started to become better at it with myself, with others, asserting my boundaries well enough where I was protecting myself, but I wasn't doing it for me as a selfish thing. I learned that that selfishness was different from doing for self. And that when I'm doing that, when I'm protecting me, I'm also protecting the relationship.
There's a lot here. And it goes into a deeper conversation too about each of our own individual beliefs about what therapy is, about what helping is. And I know, just to stereotype, the perspective from a social worker versus a clinical counselor versus a psychologist about what is helping, those are very different. And so there's also these different cultures within systems, within different factions of the mental health world. You talked about self-care, and I think we've gotten really catchphrasy about self-care. Like we need to tune into Goop and Gwyneth Paltrow and Oprah and have a conversation about self-care. And as we joke about it, also like is not something to be taken lightly, because it's so quickly the thing. Self-care, I think, especially in the last few years, but self-care to me is kind of like how a lot of organizations view like auditing departments. Like, well, if it's not making us money, then we'll just get rid of it, or HR. Like, it's like, we can do without this.
Right.
Can you dispel that myth that we can do without this? We don't, self-care is this luxury. Can you speak to that?
Okay. I'm going to answer that in a couple different ways. We have the stress response, right? And the thing that separates normal existential stress from chronic stress or toxic stress is the idea that in some way we're in an environment that is negative, but also not doing something about it. Now, there are some people who can't, but we help those people with regard to that trauma. But helping us recognize the environment that we're in that may be unhealthy is also an environment that we help create by not caring for ourselves or setting boundaries is really an important thing to consider. I understand that there are some people who can't get out of their situation. Like I would never say to a domestic violence victim, why didn't you get out sooner? Because of course I'm not shaming them, I'm not blaming, but I want to know what contributed to their staying so that I can help them understand for themselves how they can maneuver themselves through that situation better. Some people, it takes many years to get out of such a relationship, right? I don't want to get too far off track, but the idea is that, I'll put it this way. I have a favorite quote. Elizabeth Gilbert said, "Embrace the glorious mess that you are." It's the idea that we need to accept ourselves for who we are, that we're unique and we're going to make mistakes. For me, compassion fatigue and trauma are very closely intertwined, obviously. Trauma takes away our sense of safety and security. It diminishes it, right? Compassion fatigue does the same thing. It diminishes our sense of safety and security because we don't feel like we have control, because we're always tired or we're cynical. And in my research, what I found was the things that help restore a person's sense of safety and security are 4 things. It's mindfulness, it's humor, forgiveness, and gratitude. These are really important concepts and probably something that I incorporate in some fashion in just about every session. I want to know what that person's grateful for. Why? Because it increases the sense of, from a physical sense, endorphins and serotonin. I also want people to help them forgive some of the things, whether it includes themselves, a family member. You're not condoning what somebody did. You're helping let go of the pain associated with that continues to anchor us into, I believe, anchors us into despair or hurt, right? Use of humor is always good. Again, increasing endorphins, using it when it's clinically appropriate, of course, but helping people acknowledge from a different perspective that grief and loss can be seen differently, that we can learn to remember the good things. And I ask people, what's your favorite story about this person or this loss, or how did you experience this loss? What was something that you miss from this relationship? Because I want to help people understand the balance. Because again, self-care is about balance. Not all loss is about loss. Sometimes it's just about the lack of celebration, if that makes sense. And then, of course, the other one, gratitude. There is, in some of my research, there was a list of 25 things that people could do, and each one was empirically researched with different articles to show that it did increase endorphins and or serotonin. And it was everything from taking a hike to getting your nails done, right? But it was also about finding humor. Sometimes it was about physical touch or affection or cuddling. Sometimes it was just smiling randomly. Sometimes it was getting into a good book, gardening. Any of the things that help kind of slow us down or remind us that we don't have to be on the go all the time is really important. So I hope I answered that question, but...
You did. You absolutely did, because I think you just went deeper underneath this idea that self-care has to involve a lot of time or a lot of money, and that's not necessarily neither of those are resources at any given moment that we may necessarily have, and we may not have them for a very long time. So this idea that maybe we can sprinkle in self-care, even if we can't spare an hour and 15 minutes to get that mani-pedi, or we can't spare the funds, or we don't have the childcare, or whatever it is. But I appreciate what you just said, where it was like, it doesn't have to be the activity, quote unquote, in the glossy pages of a magazine to offset the experience of compassion fatigue.
It doesn't have to be how do I put it? And I forget the term, but the glorified nature of what people do on Facebook or Instagram or any of the social media posts, where you're seeing a litany of things where people are doing like fun, amazing things, but you see them in succession. Not one person is going to Jamaica and then, going to the Gold Coast in Australia or paragliding. They're not all, it's different people too, but we get into our minds that we're missing out. And sometimes we don't have the funds, or we get low on ourselves. And sometimes it's about doing simple things. It's about sitting in silence for 60 seconds. There's been research done where they've done mindfulness. And this was I think it was in Washington, and they've done it in California as well, where they've taken elementary age kids, school age kids, and they've done 1 minute of meditation 5 times a day. And they have, they did this when they get into the classroom. They do it once before recess, once after recess, once later in the afternoon, and one time before they go home. Parents reported that their children were calmer when they got home. Test scores improved. Detentions went down by 98%. Fighting went down by 98%. And 86 or 87% of the teachers said that they would offer that in their curriculum again after the research was done, because it was so effective. The other thing that I go on is this idea that there was more research done with positive parenting program. It's called Triple P. And it started in Australia, and it's in, I think, over 30 countries now. But the idea was that they found in their research that shutting off your phone and sitting with a child for 10 minutes without electronics and just engaging with them for 10 minutes was more effective in terms of the positivity it placed on the relationship than it was just sitting for 2 hours in a room watching television with them. So it can happen. We have to make it a point to do that. It's not easy. I'm sitting here and I'm having this interview, like I know what I'm doing, but I admit that I don't do it as well as I preach it either, because life does happen. But it's a matter of finding something, not just weekly, but daily, that you can do, even if it's for 2 minutes. So I have forced the Calm app, I love. It's been very effective, the Headspace app. A lot of times I'll just use Tibetan singing bowls from YouTube and do that for 1 minute and breathe every time I hear a chime. It's about just kind of getting back to this essence of self and setting boundaries and having peer supervision to talk about things that are difficult so that you can share in the pain. So, I also equate it to this idea of having a tension headache. You got one piece of the headache in one part of your head. They say to press on other parts of your head to kind of increase the surface area of that pressure so you don't feel it as much in one place. And I've done that, and it works. So I often feel like emotionally that works as well. If we're displacing our trauma and our pain by communicating about it, I always say that that's a really good thing. I tell my clients 2 things. One is, if you fall on your face, at least you're moving forward, meaning it's okay to make mistakes because we're going to learn from them. At least that's the hope. The other thing that I tell them is that communicating your pain can be a gift that you give to others. I think that's one of the things that helped me understand compassion fatigue and trauma better, was knowing that if I gave it voice, it had less power over me. It's very much in line with a Brene Brown kind of the power of vulnerability. But I subscribe to that, and it's worked for me and my clients for the most part.
What about when we're already
in it?
Yeah, I was going to say past the point of no return, but that's not accurate because we are capable of returning. So when we are mired in it, how do we get out of it? And I know for myself and from conversations with colleagues, sometimes there are things that happen in life that are just completely out of our control. And for me, my listeners know my son has major illnesses that can sometimes completely sideline the best laid intentions for quote unquote self-care.
Sure.
And also the demands of work and the rest of what it means to be an adult. So how quickly any of us can kind of be propelled into a place of feeling like our cup is empty. When we're there, what do we do?
I think, and I experience this with my clients. I have a client right now who has a special needs daughter and has done more by 5:30 in the morning than most people have done in 4 days. And I'm sure many listeners can acknowledge that. The best thing to do is to, I think, maintain open lines of communication. Sometimes it's having the knowledge and awareness. Sometimes it's difficult to tell our partner, hey, I can't do this for my child because I'm worn out, because we're worried about the stigma, or we're worried about how it sounds or how it might feel later on. I want to encourage people to set boundaries. And I know as I say that, people are going to say, this guy doesn't know what he's talking about, because, where's your kid? I don't think it's going to happen every single day. That's not what I'm saying. It's understanding that some things are out of our control. This is where the forgiveness aspect comes in, that we get to forgive ourselves for not being available 24/7 because sometimes we need to recharge. By saying to our husband or our wife or our partner or whomever, or family member, significant other, that, hey, I need you to take Tuesday on like it was like I wasn't here, like I wasn't available, because they're going to need you to do the same. But it's that kind of awareness and further communication that can really open up the way in which you see the relationship, how you take on the pain of not wanting to forgive yourself to a degree when those things happen. And again, I understand that I say this in slightly, admittedly, within a bubble, right? Because I don't have a special needs child. And one time I said something like this to a client who was having a difficult time in her marriage. And she said, and I gave her a quote, just like we do. And she said, that's a great quote, but it doesn't help me fold the laundry. Mm. And there was something about that where I was like, wow. And it made me, it was a gut check. And I thanked her in the moment. I said, yeah, I think we're done for today. It was just a moment where I was like, I really needed to ingest that and own it. And she was right. It's a great quote, but it doesn't help fold the laundry. As far as the boundaries are concerned, I think the boundaries go hand in hand with communication. The work is always going to be there. We're never going to get ahead of the work. And I think that's another acceptance of limitation that goes along with our need to communicate the boundary so that we can help change the dynamic within the relationship or the system.
When I think about boundaries in therapy and between therapist and client, I think it gets really muddy for us. Like, as you said, if a client says, I'm only available at 8 p.m. and we don't usually work at 8 p.m. And so then are we doing gymnastics to try to accommodate it, or we're not going to watch our favorite TV show that day, or whatever it is, in sacrifice. And I remember a quote that I can't attribute appropriately, so I apologize to the person who said or wrote this, which was, resentment is a sign that our boundaries have been crossed. And when we start to feel that clinically, it's such an interesting microcosm, macrocosm phenomenon that when we set boundaries with a client, we're actually modeling for them how to set boundaries themselves. And yet it can sometimes feel the narrative that we tell ourselves as therapists can feel negative, self-centered, insert judgmental language here.
Sure.
And I think one of the things that's coming up for me as you're talking about it As someone who has spent a great deal of time not only studying this and understanding this phenomenon, but you as a human, as a therapist, also reflecting on your own experience of it, were you to have a prescription pad for a compassion fatigued therapist, what would you prescribe?
It's a great question. The first thing that comes to mind is a box of Oreos. But I know you're not supposed to reward with food, but whatever, you can judge me. I would say, honestly, one is in using intentionality, SMART goals, right? Specific, measurable, attainable, realistic, and time-bound. I think those are excellent for us in our personal lives because we always, in terms of CBT, we preach it to our clients all the time. I think sometimes, and I'll do that with my wife, like we'll talk about things and say, what do we have coming up? How are we going to effectively get through this, right? And you can't plan for everything, but you do your best to manage at least some of the outcome if possible, or just be better at communicating about it so that you can get through it better together. I think connection, as long as we're talking about that, connection is also important. Connection to self, connection to others, anxiety management, self-soothing, utilizing different techniques, whether it's in the moment. Again, self-care, setting those boundaries. For therapists, I would say peer supervision and peer support, because I know those have been immeasurable to me. Bouncing ideas off of other people. Something I do, with therapy is that I teach because it helps inform my teaching. And then when I read papers and get insight from people who don't know as much, like it informs my therapy because it brings me back to the basics. And sometimes for me, it's keeping things simpler. When we find that we're out of control, or I'm going to speak for myself, but when I find that I'm out of control, I try to look and see why it's out of control, or where the anxiety, or what's contributing to the anxiety. And a lot of times it's because I find that I haven't set boundaries. I've done things that are outside my boundaries, such as seeing a client at a different time to meet their need when it doesn't necessarily meet mine. Saying yes when I really need to say no because I'm exhausted. I had a student one time who wanted a referral from me. But this was a person who didn't come to class, and she had a great deal of many problems, which I respected and I understood. But the effort wasn't there. And I thought she wanted me to write a recommendation. And I kept thinking about why I was so flustered by the idea of it. And I realized that it was going to take me more time and energy to write something nice about somebody that I didn't, for the first time ever. And the only recommendation letter I never wrote for somebody, and I've written probably over 80 or 100. But for the first time, I didn't do it. And at first I felt guilty, just like we do. And within about 12 seconds, an amazing emotional and physical warmth fell over me because I felt so much relief about not having to go through that struggle to make something up about about words I didn't feel right about writing. But because I set that boundary, and I wrote her an email. I said, respectfully, I have so many things going on that I really don't have the time. But I can give you referrals to other professors who might ... But I remember it was one of the first times where I actually felt a physical relief from having set a boundary that felt appropriate and necessary. And that's really what it's about. It's so many times we don't set a boundary because we worry about the repercussion. And we get into that future thinking about, and the anxiety of future of repercussions, that we often choose not to set that boundary because of the difficulty that comes with setting it, the discomfort. And what I've found that with compassion fatigue, a lot of times, yes, it's our own unresolved trauma, but it's really about respecting ourselves enough and our relationships enough that knowing that it might be difficult at first for the other person, for ourselves, but in the end, those who respect us enough and love us enough will respect the boundary, and it enhances the relationship. It doesn't do the opposite of what we think it would, doesn't diminish it in some way. It enhances the relationship. I believe that most of the time, for the most part, because I realize I'm speaking in generalities, but.
As you were speaking, a couple of things occurred to me in my interview with Jill Johnson Young about her grief work. She talked about how she will hold a cup of cold or ice water when hearing someone's grief story, and she's listening to the story and simultaneously grounding herself through this ice water and this idea of kind of these moment to moment decisions to ground and be aware of herself in the room as Jill, not just as therapist. And the idea of finding space to set boundaries, I think, for many of us can be very scary because of a pervasive culture of scarcity. If I do this now, then I won't have enough of XYZ down the road.
Sure.
And it's been an interesting experience for me. And I remember talking about this in an interview not too long ago. I do feedback informed treatment. That's my jam. And I did my typical end of session rating scale with a client. And thank goodness that the groundwork was there. And the client shared that we missed that, there was there was that space in between us that didn't jive and didn't land. And how the client had interpreted it was that, I was judgmental, or I wasn't present, or I can't remember exactly what the interpretation is, but nonetheless, the effect was still that I conveyed a lack of empathy. That was just the bottom line. And that there was a space between us that, as I see it, what we do in relationship with anyone is, are we closer together? Are we the same, or are we further apart at the end of that? And at the end of that moment, the client and I were further apart. And so thank goodness the client had the courage to tell me that. And we talked about it. And wouldn't you know it, that night before, I had gotten very, very little sleep and, was rushing out the door, and there was an emergency that happened in my home. And here I am bringing this into session, projecting my stuff that's affecting that space between us. And it was such an interesting lesson for me. And I'm curious for you, when we are burned out, when we are compassion fatigued, do we tell clients that? So for me, it was this really interesting experience where it was that was really cute, Beth. You thought that you were going to pull a fast one on your client, and they were not going to know that you didn't sleep well last night and that you're exhausted. Cute. And
gotcha.
And I got to do the repair with a client and saying oh, hey, here was actually what happened. And I apologize. I'm sorry. I reflected back on that. It's should I have front loaded and said to the client, hey, just FYI, I am so happy to be with you today. And I got very little sleep last night.
I love that you brought this up, because I always say that nobody will ever accuse me of not being real. I am who I am. And I do bring humor into complex trauma situations, simple trauma, depression, anxiety, all of it, because it's who I am. Now, could it be part of my defense mechanism? Is it because I grew up Jewish and it's my birthright to use humor and everything? I don't know. I think for my clients, they will ask me, they always want to know how you're doing, right? They always want to be invested somehow in the relationship, I think, to a degree. And there are times, depending on the relationship, where I will tell them, oh, I'm putting the house together. I wish my handyman would finish the job, and I might be honest with them, because it lessens the tension of the rope that I feel we're both holding in the relationship. It allows for a relative closeness, and you get to decide what's appropriate and what to disclose. But obviously, I think I do, when you're in grad school, they say disclose what's clinically appropriate. And I agree with that, of course. But I think what we're learning about relationships with the client is that you can go beyond maybe what's not entirely clinically appropriate, even if it's one sentence. That somebody should know that I recently moved and moving is a stressor. Hey, I'm sorry. I just want to let you know, don't be afraid to call me out today if you don't think I'm paying attention to something, or if there's something that you really want to identify better, let me know and emphasize it for me so that I can perk up. There has to be a humanness. For somebody who sees, if you're seeing anywhere between 15 to 40 clients a week, somebody can handle 15. We all have different capacities for tension, for anxiety, for whatever we do. And if 15 is your max or 40 is your max or whatever, however unethical that might seem, but we all have a different gas tank. Some people are the size of a Yugo. Other people are, full on tankers that pull into Costco gasoline, and, it just depends. But I do believe that there is, at least for me, it has benefited my therapeutic relationships and alliances to divulge a little bit about who I am and what I'm experiencing in that day or in that moment, because it helps the client feel like they're also not alone.
Yeah.
That idea, when you first see your parents as a person rather than a parent, that realization, there's something that opens up in that world and maybe deepens the relationship or surprises you or intrigues you about the relationship. But maybe there's a greater investment in the relationship because you're allowed to be real with them and you're allowed to open up where they can feel like they can be more vulnerable because you've shared just a small part of who you are. But that's how I operate. I try to make sure that it's as clinically appropriate as possible. I don't give them entire details about, what I said to the handyman or what I don't, but you give them a little part of your day. Somebody cut me off. Rutabaga wasn't on sale. It was last week, but you know what I mean? Like whatever it was. So, yeah.
It's the idea of what is clinically appropriate. That in and of itself is a huge conversation that many people could weigh in on. And it's been interesting too for me to sit back and watch the field, even in the last decade, of just this major shift from therapist as expert to therapist as human. And in retrospect with that client, I appreciated being called out. And it was a real learning lesson for me of like, aren't you cute? Like, thinking that no one would notice. And I agree with you where it's like every clinician has to decide what's appropriate for them. And of course, there's a big difference between a quick little sidebar conversation of this is what's going on in my world and you client, come soothe me, let me tell you this story and let's spend 15 minutes about it. Those are totally different things.
100%.
But I think there's a authenticity in that is absolutely potentially clinically relevant, clinically important. So my question for you, when we have the blinders on of compassion fatigue, chances are we may not be seeing ourselves clearly. We may not have, by nature of the beast, we may not have the same checks and balances within ourselves, the same awareness to catch ourselves. So what are the signs that we need to be looking for?
Okay. So some of the warning signs, the symptoms can be mood swings. It could be restlessness, irritability, oversensitivity. Sometimes it's doing things that feel excessive, where it's either substances or shopping online, or if you find yourself, my wife can't leave me alone after 1 a.m. because if it's on TV and it's got a space age polymer or a lifetime guarantee, I've likely purchased 2 of them already, so I've been on restriction at times. But sometimes it's knowing that something's outside of your, for lack of a better word, normal behavior. Sometimes there's more anger and resentment, loss of objectivity, memory issues. A lot of times with compassion fatigue, it'll take us twice as long to do the same amount of work, where you're reading the same paragraph 2 or 3 times. Physically, it could be somatic. It can be digestive issues. It could be muscle tension, sleep issues, fatigue, sometimes heart problems, headaches. Sometimes people would get those more often. So those are some of the symptoms. As far as the warning signs, they're pretty much same vein. But sometimes we could feel powerless. We can feel shut down or numb, helpless. Like I said, hypersensitive. Sometimes we can feel more rigid, or maybe there can be a decrease in self-esteem or efficacy. That imposter syndrome kind of becomes a little bit more inflated. A lot of times there's denial about problems. I'm fine. How are you doing? I'm good. I'm just tired. And we, instead of really acknowledging something that can be laid out more specifically, because we're afraid to lay it out specifically, I think sometimes, because if we do, then we're acknowledging there's an issue.
Yeah, the thing.
Right. Sometimes there's also an intense self-criticism that comes with that. Again, and that lends itself to the idea of lower self-efficacy or
the
esteem.
shoulds. I should be
absolutely.
able to do this.
The self-esteem killers, absolutely. The shoulda, coulda, wouldas. So those are some of the warning signs. Behaviorally, we could become socially withdrawn or needy. Depending on the extreme, we could be impatient. Maybe sometimes we can become more accident prone because we're not as focused. Or spiritually, we just feel like there's a loss of purpose. I mean, how many times have you questioned yourself in this field because you encountered something that was difficult or that you didn't know, or, I mean, maybe less so now because we're more seasoned, but I know especially for beginning therapists, this is an issue. Questioning ourselves. Sometimes it's dissatisfaction, weariness, lack of faith or trust in the process of things, general intolerance. So those are all warning signs for caregivers.
Thank you. I appreciate you breaking that down. I don't know if you know the answer to this, but I'm curious. Has the research looked at what percentage of clinicians, of therapists, experience compassion fatigue at some point during their careers?
Burnout has been shown to affect early career mental health professionals at moderate to high rates of greater than 52% in studies. This was 2014, Volpe et al. But so I would put it at right around, if I was to guess, at any given time, it's at least 50% that people can experience compassion fatigue or burnout.
I think that number is really important to hear. So you were at a higher probability of experiencing compassion fatigue and or burnout than you are not. And
technically, yes.
Something about that, I think there's that element.
Especially for young therapists.
There's that element of normalization. At least for me, I don't know if I know a clinician that isn't somehow burnt out right now.
I mean, I agree. And part of the issue too is that research really, well, at least in the last, from what I understand, at least in the last 5 to 10 years, research doesn't really exist on coping strategies in what they called, quote unquote, seasoned professionals. But when I started doing this research, I had a difficult time because there was really no research that had been found studying the pre-licensed and newly licensed professional. So one of my arguments in my dissertation was that it needs to become an ethical standard for us, that to a degree that, and I know this is going to sound funny, but we need to take many vacations, or that we have an ethical responsibility to be as present as possible. Granted, we have our own lives. I mean, I don't know of any therapist who hasn't thought about a grocery list, one time or another when they're dealing with, say, somebody who's more content rich or, not so process oriented, and they're just kind of listing their content. And you're like, and it's 4:00 in the afternoon. I don't know that anybody's truly effective at that time, but are you giving yourself enough time between those sessions? Are you doing something effectively?
I appreciate that concept of a mandate. And I want to share a quick little anecdote in what I call a past life. I worked as a surgical coordinator, and the doctor I worked for did extremely detailed surgeries every Wednesday. And every Wednesday, he wouldn't have coffee. And he had this whole procedure on Tuesday nights and Wednesday mornings about what he was going to do leading into surgery. And it was a good example for me to watch this MD take responsibility for the accuracy and appropriateness of what he was doing medically, because he knew that if his hand shook because he had caffeine, that it could have serious consequences for that surgical patient. And I think it's easy for us as mental health professionals, myself included, to forget that sense of responsibility, and whether we actually have taken it or not, but this concept of a Hippocratic oath, and that part of our self-care, part of our professional responsibility is this awareness. And simultaneously all the more burdensome when you're burnt out, where it's like one more thing I have to do.
Right.
But I do appreciate what you're saying there, where it just needs to be this foundational thing. And if we're already there, then what are we going to do to recover, to catch ourselves, to seek connection, to seek the four which you named? So mindfulness, humor, forgiveness, gratitude. How do we access those so we can pull ourselves out of a place of inefficiency back into presence and efficiency, just as that surgeon did?
I love that. I mean, the answer is do a workshop, do training, because like I'll do workshops or I'll do trainings, but a lot of times we'll do experiential things. And you can do it via Zoom, you can do it in person, but like a forgiveness exercise, a gratitude exercise, learning how to be more mindful. I didn't know a lot about mindfulness before I started my research. And I was the guy that either fell asleep or I got headaches because I was trying too hard until one person had said in a training, she said, just go ahead and allow yourself permission to let all those other thoughts come in. And I thought, oh my God, what a concept. I allowed myself permission for those thoughts to come in and just sit there, not pay them enough mind or attention. And then my headaches went away. I wasn't falling asleep. I was in that, unconscious or subconscious state. And I actually started to understand what mindfulness was more about. I didn't have to be perfect at it. The misconception about this is that compassion fatigue happens to us, and you don't have to be perfect. You don't have to seek perfection. The idea is that if every once in a while you're not eating lunch at your desk, or every once in a while you go on a hike, or every once in a while you plan a 3-day weekend vacation if possible, or you get a babysitter one night over each month, because everybody can do that, then plan something that you really want to do, or make a list of 5 things that you want to do in the next 9 months that are realistic and time bound and, and attainable. And I think those things help reduce our sense of obligation, this perceived sense of obligation, if not a real sense of obligation. But a lot of times we really put our own selves to the fire, just like any client is their own worst critic. We're the same. So I always want to encourage people to do something that they've been wanting to do, but to just plan for it accordingly, or break it down, deconstruct whatever your dream is, or whatever it is you want to do. Deconstruct it and see if you can do it in different ways. I just recently moved to Texas. My wife said to me the other day, because we were busy putting the house together and we were just exhausted. She said, "What do you want to do?" I said, "I want to go see some steer." I literally just wanted to see animals. And so we drove to Fort Worth and went to the stockyards and went to go see steer, because I am a child and fascinated with farm animals. But it was something that I needed, and it was something that we could do within 2 to 3 hours.
Oh, specific, measurable, attainable, realistic, and time-bound?
Yes. Can you imagine?
So speaking of time-bound, we are out of time for our conversation today. I know that this has been very eye-opening and impactful for me. Dain, for our listeners, will you please share how folks can learn more about you and your work, and also any resources that you recommend for them?
Yeah, absolutely. You can check out my website. It's dainkloner.com, DAINKLONER.com. I really love the website, by the way. I want to throw that out there. My friend Mike at Pix Ninja did it, so I'm very proud. And you can also call, if anybody does need help, 213-479-8730. And then I also want to recommend that people check out the Compassion Fatigue Awareness Project online. I think it's compassionfatigueawarenessproject.org. Also the ProQOL, ProQOL-5, I believe. You can just type it into Google. And it is a compassion fatigue self-awareness test, and acknowledges how you're doing with self-care. It's a great resource. Something just to get a baseline. Say, maybe I need to work on this a little bit better. I need to take more time for myself. But it just kind of lets you know where you're at. And it's not meant to be an end-all be-all. It's just an interesting thing to help you kind of gauge where you need to work or what you might want to improve on. And that's something I'd probably do once every 6 months, because we all get off track. So that's what I recommend. But this has been great.
So again, that was the Pro QOL5 self-awareness test.
Yeah. Yep.
Thank you. So again, for our listeners, this was Dr. Dain Kloner joining us on this conversation about compassion fatigue with a little bump out into burnout. Thank you, Dain. It's always wonderful to talk with you, but particularly
Likewise.
meaningful today. So thank you for sharing your experience and your research and your soul with our listeners. I appreciate it.
Thank you for having me. I'm really passionate about it. So anytime I get to talk about it, and it's not a bar full of drunken sailors, it's good. It's good for me to be able to talk about it. It's important. It's important, especially for our profession. So thank you.
Thank you for joining us.
You've just finished listening to another exclusive Continuing Ed podcast by Clearly Clinical. If you like what you just heard and you need Continuing Ed credits, please visit us at clearlyclinical.com to check out our 1-year membership, where you'll have access to our growing library of Continuing Ed podcast courses. Clearly Clinical, where our goal is to help you learn, grow, and shine.